All right, let's expand a bit more on this. SABC News foreign editor Sophie Mokoena joins me now live. Sophie, very good evening to you indeed. We heard from Professor Karim there saying that this is not going to affect South Africa's start date in terms of the vaccinations. We're expecting the doses from Johnson & Johnson. Is this a huge crisis, and has there been any word from AstraZeneca?
Well, AstraZeneca issued a short statement yesterday saying that they will share more information. But what has since transpired is that it looks like in terms of the research that was done on the second wave and the new variant 501YV2, it was just a small group of people and very young people, and therefore the results cannot be conclusive. There are reports that in terms of how vaccines operate, there's a likelihood that these very same AstraZeneca vaccines will be effective, particularly on patients with severe illness, but also to reduce deaths. And that's all what countries want. They don't want to see their citizens dying. And I think now the question is to achieve that. How do you do it? But the other information to note is that the pharmaceutical companies, the developers of these vaccines and the manufacturers will have to adapt the vaccines to new variants, because the reality is phase 1 or wave 1, we didn't have this kind of a problem or this kind of a variant. The second wave, we now have this variant. The third wave, we may have another variant, and the fourth wave, another variant. Therefore, like Dr. Tedros has indicated, they will have to adapt their formulas or the vaccines. Let's take a listen at what Laura Ashworth had to say, our reporter in UK, about this matter of adjusting the vaccine.
They're going to have to adapt. You know, scientists have been working on this vaccine very, very quickly. The rate at which they've been developed and then pushed out to the public has been unprecedented. And of course, they were expecting new variants, new strains to emerge as the virus passes through the millions of people around the world. They will be looking at it. Scientists are already working on a new jab to target these new strains. And, you know, here in the UK, some scientists are saying that AstraZeneca and Oxford could have a new version of the vaccine available for rollout.
So, Sophie, I mean, has the Serum Institute and the Indian authorities shed some light on what happened? We saw questions from last night, just some of them also arising on, for example, the expiry date on this consignment that was brought to South Africa.
Well, Criselda, the two institutions who spoke about are still mum. The government of India is mum, saying that they were not involved. Surprisingly, there was a letter sent to President Cyril Ramaphosa asking him to apologize for not extending a thank you to the Indian authority or the authorities in India. But it looks like India is saying we were not involved. It was a transaction between the South African government and a private company, and therefore this matter must be directed to that private company. Let's take a listen at what Nihapuna had to say from New Delhi in India after she spoke to both the manufacturer and also some officials in the government.
We haven't heard officially from the Indian government or from the Serum Institute yet, but sources in the government have told me that they're aware of the development and they're keeping a close eye on what happened, and they will, if need be, comment in the days ahead. The source in the government also told me that they're not getting involved just yet because this was a commercial agreement. It was signed between the government of South Africa and the Serum Institute of India. So it was a government and a company agreement and has nothing to do with them. I've also reached out to the Serum Institute and they've declined to comment on this particular issue yet. Instead, they've said that they are keeping an eye on this and they cannot issue a comment just yet.
Sophie, if at all we can, how can this in future be averted? Because what we're hearing from scientists at the moment is that the original trials that were conducted were on the virus in its original form. Because, we can't rule out in South Africa at the moment. The scientists have already said, the health department has already said, a third wave is on the cards and possibly a fourth wave as well.
I think they have learned something with this development. And I think, as it was indicated earlier on by Laura, they will have to adapt as the virus mutate, because we know the virus does mutate. And therefore, I think it's up to the scientists or people who are involved in the lab that are busy with manufacturing of vaccines to ensure that in future there are perhaps doses that can be administered to strengthen the first dose if the virus mutates. And therefore, I think it's up to those who are in the labs to use this opportunity to strengthen their knowledge. When you look at the Spanish flu in 1918, we know that when there was that outbreak, majority of people during the first wave who were affected were elderly people, the same what we experienced with the coronavirus. And therefore later it was younger people, and they really infected many people, and people died in numbers, and they also died in large numbers because of the mutation. And therefore now the scientists, perhaps they must go back and check what went wrong, because now this is another pandemic, a big one after 100 years, and therefore lessons learned then, so that they can be able to come up with better solutions. And the discussions today at the WHO, you can see that there was a serious discussion, and Dr. Tedros has indicated that he's going to study the recommendation from scientists and the team from WHO that was presented to him today in terms of what transpired with AstraZeneca, so that WHO can advise countries. And I think we'll get a better clarity also from that advice that has been forwarded to the WHO Director General, Dr. Tedros, in terms of what countries can do to avoid this. But this vaccine is being used in many countries already, even in Britain. Earlier on, Boris Johnson, the Prime Minister of Britain, defended the product because it's manufactured it was developed by scientists at Oxford University in UK. And therefore later today at 9 o'clock South African time, the Secretary of Health in UK is going to give more clarity on the latest developments. So it is, this is the time for the world to work together and share information.
Sophie, before we let you go, I have to address the issue of the Democratic Republic of Congo, a case of Ebola also that's been detected there. The WHO also bringing that up, saying that they are taking a look at that particular matter, but also an area of concern.
Yes, indeed, particularly on the continent when we are trying to find solutions to the current pandemic, that is COVID-19. But I think because of the experience there, it will be managed by those who are involved in the combating of Ebola in the Democratic Republic of Congo. Incidentally, the president of the Democratic Republic of Congo is currently the chair of the AU, and therefore I think it is going to be a challenge for him, but I think WHO is there to assist. And normally Dr. Ryan always indicate that the experience that Africa has gathered around the Ebola crisis, we are currently using the same formula in terms of ensuring that there's isolation, quarantine, education, and particularly the ordinary people being involved. And I think they will be able to manage this outbreak, and I think Africa will be fine.
SABC News foreign editor Sophie Mokoena, thanks indeed for joining us here on The Full View. I'm sure you'll give us updates when and if AstraZeneca indeed does give us an update on the latest developments, in particular coming out of South Africa.